Good morning, Nadia. First of all, I hope you had an amazing weekend. This is the first time I have been at the Cowichan campus, so I was wondering what is exciting to do in Duncan. Maybe you can give me some suggestions after we are done today. So let's review the Canadian healthcare system. But first, I'd like to ask a question. I'm wondering what your opinion is on healthcare in general. Do you think it is a right or a privilege?
Hannah, I had this discussion the other day with my classmates. Some think it is a right as Canadian citizens to have free healthcare, while others think it's a privilege and that we are very fortunate to live in a country that has a public system. What do you think?
That is a great question, Nadia. I think it is a bit of both. It is our right as Canadian citizens to have access to healthcare, but it is also a privilege to have that. It's an interesting debate though, and I'm sure that many people have some great thoughts on that. Let's switch gears a bit here and talk about the Canada Health Act. The Canada Health Act became legislation in 1984, which I'm sure was before you were born.
It was definitely before I was born. People born then must be so old now.
The Canada Health Act reaffirmed what the 5 principles of Medicare are in Canada. The reason these principles were developed was so that all the provinces and territories governed healthcare in the same way. Do you know what these 5 principles are?
Hannah, I know that one of them is comprehensiveness. From my understanding, that means that all medically necessary healthcare provided by physicians and in hospitals must be covered by provincial health plans.
That's correct, Nadia. What are the other principles?
I know that another one is portability. It means that healthcare is portable between the provinces. I know this because when I went to visit my grandma in London, Ontario, I broke my ankle and my BC Health Insurance paid for it.
That is correct, Nadia, and that is a wonderful example. However, I'm sorry you broke your ankle.
Thank you. Believe me, it wasn't fun.
Another one is universality, which is that all residents of a province be entitled to insured services through uniform terms and conditions. Accessibility is another principles. All provinces must provide insured healthcare services through uniform terms and conditions and must provide access to these services.
Hannah, what do you mean by insured healthcare services?
That is a great question, Nadia. Insured healthcare services are ones that are covered by the healthcare plan. For example, cosmetic surgery like a facelift isn't covered, but gallbladder surgery is. The final principle is public administration. The administration of healthcare plans must be non-profit, run by a public authority appointed by the provincial government and responsible to the government. There must also be regular audits. Let's review them. Public administration, administered and operated on a non-profit basis. Comprehensiveness must include all insured health services. Universality, all insured residents must be entitled to healthcare on uniform terms and conditions. Portability, ensuring coverage moves between provinces and territories. Accessibility, or no financial barriers or user fees.
Thanks, Hannah, I understand this a lot better now.
You are very welcome, Nadia. Now let's talk about what is fun to do in Duncan.